Hi, in this part of Psychiatry in 5 minutes, we're going to be talking about anxiety disorders. If you want a very, very brief lecture, treatment for anxiety disorders, pretty much the same as depression. That is, you try SSRIs first. But all of the anxiety disorders, unfortunately, can be more chronic. And people, when they come to see you, very often have another episode or another diagnosis, which is why they're coming to see you. In other words, they've been anxious for a long time or having panic attacks for a long time, but they're there now because they're now suffering from a major depression, or they're there now because substance use disorders are out of control. So somebody presenting with anxiety, always look for that other DSM-5 diagnosis, typically depression or substance use disorder, or both. Treatment for all the anxiety disorders is begin an SSRI. The difference is you start at a low dose and more gradually build it up. If you push it too much too soon, somebody can feel anxious or agitated. So do it at a low dose, gradually increasing. Generally, for anxiety disorders, we think it takes longer for symptoms to improve, and often because it's so chronic, we often try for things to be much better. We aim for remission, but it doesn't always happen. So you aim for getting the best you can. Other medications are used as well. In PTSD, prazosin can be used for nightmares. The idea is that nightmares cause things to get revved up, and prazosin, an alpha blocker, keeps things from getting as revved up, so you sleep through the nightmare is the hope. Works for some people, not for other people. Propranolol or other beta blockers are used for performance anxiety as well. For OCD, you try an SSRI first. If that doesn't work, fluvoxamine, another SSRI, can be tried. That's not first line because you have to take it twice a day. If that doesn't work, the pill that works the best for obsessive compulsive disorder is clomipramine. Benzodiazepines can be used, but they're the devil's drug. And by that I mean the problem with benzodiazepines is that they work, meaning that they will quickly have people feel better. But the problem is a chunk of people, 10%, 15%, can become addicted over time, which is a lot of people. The benzodiazepines vary in half-life. There are short-acting pills, such as alprazolam, with a half-life of only 4 hours. And over time, they can develop a tolerance, and that can decrease. So somebody can be withdrawing from alprazolam every 4 hours, and they may feel they're getting anxious and need the pill, but they need it because they're withdrawing. The moderate length, that is, lorazepam, lasts for about 12 hours, and then clonazepam lasts for about 30 hours, or diazepam about a day. If somebody has trouble, or if you want to try to get somebody off of benzodiazepines, it's better to switch them over to a long-acting medication where you'll have less trouble with withdrawal, that is, to clonazepam. Benzodiazepines are pretty safe drugs, except when they're combined with other medications. Then they can be very dangerous in overdose in combination with opiates or other medications, including alcohol. Buspirone is another anti-anxiety medication. It's a 5-HT1A receptor partial agonist. And here again, you start with a low dose and gradually advance it, just like in all anxiety disorders. Remember that buspirone can be helpful in depression augmentation as well. It's not a benzodiazepine, it's not addicting, but the problem is you have to gradually increase it. It takes about 2 weeks to kick in, whereas benzodiazepines often have an immediate effect for patients. The other treatment for anxiety disorders is psychotherapy, and generally psychotherapy is exposure for phobias. That is, exposure to the feared stimulus, but someone has to expose themselves for 25 minutes before the panic begins to fade. And doing that gradually, things will decrease. In PTSD, or post-traumatic stress disorder, prolonged exposure by repeating the thoughts of the trauma can be helpful as well. In obsessive compulsive disorders, exposing yourself to the feared stimulus and response prevention. That is not pursuing hand washing or checking, etc. So exposure and response prevention in OCD. And psychotherapy can be very helpful in anxiety disorders. So I hope you'll read more about all of this, because anxiety disorder is, again, very common no matter what branch of medicine you'll go into. Thank you.